I think that one of the reasons that healthcare marketing is so challenging is because the average consumer no longer believes the hype. And as somebody who really avoids the medical industrial complex, is like I have realized this week exactly why consumers have such like shaky trust in the healthcare system. Because I feel like sometimes there's this sense that with the doctors, and I get it, their jobs are hard, but they have the ability when they make a mistake to close ranks and refuse to acknowledge it, and there's a sense that they're willing to put that closed ranks over the quality of somebody's life, and that's scary. We had a situation with my husband. I've been at the hospital the last 10 days. And when he came in, it was touch and go, and we were terrified. We had an ulcer that went terribly wrong. And so we went in, we had no idea what was going on, and he had an incredible team of doctors that were working around the clock to make sure that they could really save his life. And I'm so grateful for that. And literally a week in, we were getting him back to good health. He had an incredible physician that was really focused on the quality of his life when he got out of the hospital, as well as him being the treatments that he was getting to bring him back to health. And so we get to Wednesday, so it was a week that he had been in the hospital at this point, and he was doing amazing. Like he was getting out of ICU. They were had moved him to another room. He was up and walking around, and they had been pushing kind of they were talking about like his kidney, and so the doctor kept saying, at this point, let's focus on getting him well with the original condition, working on his stomach, working on his ulcer. Let's get that stable, and then we'll worry about any other like unnecessary surgeries. In this instance, the doctor told me that they were looking at a little swelling like on the kidney, nothing emergency, nothing that was a necessary surgery at that moment. And so she had said twice, we'll just wait until after we've got this healed. They had him on a track to by Sunday he would be up and moving around. So really we had a track that we were following here. Wednesday we had a surgeon who kept pushing this other unnecessary procedure, and when his doctor was not there on Wednesday, they literally did the procedure. So by the end of that night, they had put him back into the state that he was in when we came into the emergency room, where it was touch and go. They're doing transfusion, and we don't know if he's going to make it through the night. And the level of anger that I feel like could not even be expressed. So I said nothing, but I did express my concern about his quality of life when this unnecessary procedure was pushed. And that's why I kept saying, like, why did the unnecessary procedure become priority if we've already said it's unnecessary and it can wait? Because the priority was the original issue, and that's what we had been focused on. Instead of getting an answer to that, what I got was frozen out. I got cold shoulders. I got nurses who, with fake smiles, who didn't want to let me in the room and didn't want to let me stay. The day of the procedure, when I called and he told me that they said that they were thinking about doing this procedure. And I tried to call up to the doctors, up to the nurse's station, try to talk to his doctor. I was frozen out every single time. I guess, I don't know if they just memorized my number or what, but they had actually been keeping up with me. Like anything that was going on, they would call me if there was any changes, because like I said, that first week, very touch and go for him. So it was an incredible team that really kept me informed. Once this surgeon stepped in and messed everything up on Wednesday, everybody closed ranks. All of a sudden, he's on a different floor, but the doctors won't speak to me. The nurses don't want me to stay in the room. Everyone's kind of whispering when I come in. And it's like, so the focus shifted. The focus shifted from focus on patient care and quality of life to closing ranks, to protecting your neck, and to a bit of self-righteousness and playing God in deciding what was best for the patient without wanting the patient to have an advocate that was there personally. You got to do better. You got to do better, because I remember during that the guy who was the healthcare CEO. I remember the craziness after that happened and the level of hostility that people had towards the healthcare industry. And I was just like, what is that? Because I don't deal with the medical industrial complex. So, but I get it now. And I'm not saying it's right, but I get the sentiment that was expressed during all of that, because there's definitely a focus on the finances. And I don't know if, hey, maybe this doctor needed some extra cash, maybe that's why the surgery was thrown in there. I don't know, but I do know that it stopped being about the patient's quality of life, and it stopped being about the patient having an advocate for their own health, their own safety, for their own quality and longevity of life. And it's like, and so now my husband is back in the same state that he was in the day that we came in. A whole week of progress has been erased, but there's a surgeon who can now say that he has another surgery under his belt. There is a team of people who can say, well, we made sure he didn't have anybody sitting next to him and holding his hand. I actually had a nurse get so angry at me and tell me, not after the doctor had said, speak to him, hold his hand. He was completely out, but they were saying that he could still hear, like what I was saying. I had a young nurse get an attitude and tell me not to overstimulate him by talking to him or touching his hand. So it stopped being about the patient and about what the doctors think is best. And that's not always the best for the patient's quality of life. And sometimes I think maybe doctors should just put their heads together and get their ego out of the decisions. Because like I said, he had a physician who was like, yeah, we could do that later, but that's not the priority right now. And there were other doctors who overruled that and didn't care that it drastically reduced his quality of life immediately. So when you're marketing these services or marketing these physicians or these hospitals, then you've got to understand that the hurdle is not bragging about their trauma centers but talk about the quality of care that their patients have when they leave those facilities, when they're finished with those procedures, because that's what patients actually care about. That's what families and advocates of patients actually care about, is the quality of life and the quality of care of the patient that in their eyes is a family member, a friend, a spouse. That's not a patient. And I think that we get so caught up in the numbers. It's another reason why I really, even in healthcare, I feel like we're pushing the AI like too fast into it, because there's already a robot-like response from physicians when patients have questions. So when you put another line, there's already no human in the loop. And that's what makes people question, where is the care in healthcare? It's like that's what we got to focus on putting back in.